Hi, my name is Bonnie. I am a nursing student from Nevada State College. I'll be doing your exam today. Let me get ready. I'm going to wash my hands and pull the curtain back for your privacy and comfort. Go ahead and tell me your full name and date of birth.
February 1st, 7th.
Okay. Reasons for seeking care?
Back hurt.
Did you have an accident? An injury? No? Okay. Any medical history, medical diseases, surgeries, trauma?
No.
Are you taking any medication?
No.
Do you have any drug allergies?
No.
No. Family history. Is your mom still living?
Yeah. She had diabetes.
Is your dad still living?
No.
No? Okay. Personal habits. Do you drink?
No.
Do you smoke?
No.
Illegal drug use?
No.
Any exercise?
No.
No. Okay. So first thing is I just do a general assessment of you. You are 46 years old.
Yes.
So you appear 46. And you are awake. You are alert. What's the date today? Tell me the month and the year.
April 2016.
Okay, and where are we?
The office.
Okay, so you're oriented times 4. Looking at your skin, I don't see any rashes. I don't see any lesions. Got a little bit of a sunburn. It looks like on your upper arms and your face. You are sitting straight. You are still. You look comfortable. You are maintaining good eye contact. You appear very serious, which is appropriate for the situation. We're doing an exam today. Your speech is clear. I can understand you. Okay. Bless you. I'm just going to look at your head. I look for the size and the shape. It looks symmetric. I'm going to feel. Okay. I didn't feel any abnormal protrusions or depressions. I'm going to look at your hair. It looks very thick. I don't see any infestations. Looks nice and clean. Your scalp looks very clean. Your skin, I don't see any excessive moisture, and I don't see any rashes, no discoloration. Next, I'm going to go ahead and look at your external eye structures. So your eyebrows, your eyelids, your eyelashes, they are all present and they are intact. They look symmetric. I don't see any redness, no lesions. No discharge. I'm going to look at your conjunctiva and your sclera. To do that, I will hold down your lower lids. You look up to the ceiling for me, please. Okay. Your sclera is moist. I don't see any drainage again. Looks nice and glossy and smooth. Let's look at your ears next. This is the outer ears. Okay, so they are aligned. I don't see any lesions, no nodules, no redness. Let's see. I'm going to feel them. Nice and firm, which they should be. They look aligned. They look symmetric. Next, I'm going to go ahead and do some eye tests on you. The first eye test is called the pupillary response to light. I'm going to have you focus on one spot. You can focus on my forehead while I shine a light in your eye. Continuing just to focus on that one spot. Okay, other side. Okay, so I have direct light reflex and I have consensual light reflex. The next exam I'm going to perform is called the accommodation test. I'm going to put one finger in front of your nose here. I want you to focus on one spot on the wall, and when I tell you to, change your focus to my finger, okay? Focusing on the wall. Now focus on my finger, and back to wall. Okay. So I have bilateral convergence, bilateral pupillary constriction, so I have perla. Pupils are equal, they are round, and they are reactive to light, and they accommodate. Moving on, now I'm going to do a diagnostic position test. For that, I'm going to have you hold your head still, follow my finger with your eyes. Okay, good. So I have parallel tracking of your eyes. Cranial nerve number 6 is intact. Now I'm going to assess the patency of your nose. To do that, I'm going to push down on one nostril. Now you sniff in. Okay, let's other side sniff. Sniff in. There you go. So sniff is present, meaning your nostrils are patent. No obstructions. I can hear a little bit of congestion. So do you have a cold? Yeah.
Yeah.
Okay. Okay. Next, I'm going to move down to your oropharynx. I'm going to use a tongue depressor and a light. Go ahead and open for me. So I'm looking at the oropharynx. It is pink. I don't see any lesions. No exudate. Your uvula is midline. Your tonsils are a good size. They're +3. Go ahead and say ah. Okay. Very good. I'm going to check your gag reflex. Present. Sorry about that. Okay, so very nice. Cranial nerves number 9 and 10 are intact. Next, I'm going to give you some directions to follow. Go ahead and clench your teeth for me. Good. Close both of your eyes really tight and open. Wrinkle your forehead. Wrinkle your forehead. Smile. Stick your tongue out. And puff out your cheeks like a chipmunk. Good. Cranial nerve number 7 is intact. Now I'm going to look at your tongue. Go ahead and stick your tongue out for me. Your tongue is pink. I see like almost a crack down the middle, like a little shallow fissure. You need to drink a little bit more water. Stick your tongue to the roof of your mouth. I'm looking underneath. It is moist. It is smooth, glistening. I'm going to touch your tongue so I can look at the sides of your tongue. You know, I don't see any nodules. I don't see any ulcerations. So very nice. Okay, moving down your body system. You are holding your neck straight and still. It's midline. Let me assess your tracheal position. I'm going to put my finger in that little sternal notch here. Okay. Tracheal position is midline. I am going to go ahead and feel for lymph node swelling. Okay. So your lymph nodes are palpable, they're soft, they move, and they're discrete. Next thing I'm going to do is I'm going to listen to your carotid arteries with my stethoscope. I don't hear any bruits. You know, when I checked your gag reflex and I had you touch the roof of your mouth with your tongue, you did all that correctly and you were able to do it. Cranial nerve number 12 is intact. Okay, so normally I would do the abdominal exam. Your back hurts, so I want to kind of limit the time you're getting up and down. So let's have you sit on the table and I can do check your reflexes. Let's do the bicep reflex first. Okay. 2 plus equal, do the tricep. I'm going to support your upper arm. You let this arm go dead for me, okay? Letting the arm go dead. 2 plus and equal. Let's go to that patellar reflex. One more time. equal 2 plus. I'm going to assess the Achilles reflex. I'm going to put your foot kind of in my palm here. Okay, other side. 2 plus and equal. Let's go ahead and assess your upper motor strength. I'm going to put my hands on your shoulders. I'm going to push down, but I need you to shrug your shoulders against me. 5 out of 5 equal. Now I'm going to put my hand on the left side of your face. I want you to look towards the left, even though I'm giving some resistance, okay? Okay. Same thing, other side. Good. Equal. 5 out of 5. Very nice. Now, let's go ahead and stand up. We'll do the Romberg test. Face me, please. Feet together. Arms to the side of your body. I'll have you close your eyes for 20 seconds. Go ahead and close. Thank you. So negative Romberg, meaning when your eyes were closed, you didn't lose your balance. That's what I was hoping for. So negative Romberg. Now I am going to look at your spine. Have you turn around, please. I'm looking at your spine. The ledge is there. It appears to be straight. Horizontal planes are equal. Now I'm going to go ahead and assess the range of motion of your spine. Go ahead and touch your toes. Come back up. Lean to one side. Now the other. Lean back. Back for me. Good. And then rotate your shoulders. Okay. So full range of motion of your spine. Go ahead and walk forward for me. And walk back, please. Okay. Thanks. So your walk is even and it is well balanced. Very nice. I'm going to go ahead and check your range of motion of your upper extremities. I'm going to tell you what to do, but you can also follow me. Arms at the outer sides. We're going to raise our arms laterally to the back of the head. I'm going to turn one side, now the other. Now let's put our arms down. Full range of motions on your upper extremities. Wonderful. Let's move to the table. So we can do the abdominal assessment and all that other good stuff. I'm going to put my hand on your back first. Check for CVA tenderness. Good. Negative CVA tenderness. You can go ahead and lay back for me, please. Bring the chair up. You can put your feet on that if you wanted to. I'm just going to look first. So looking, your abdomen, you can put your knees up if you want. Your abdomen looks symmetric. I don't see any redness, no hernias, no lesions, no pulsations, no movements of paralysis, peristalsis. Your belly is flat. I'm going to go ahead and listen first with my stethoscope. I'm going to feel my stethoscope on your belly. We listen to each quadrant for 10 seconds. You know, I hear vowel sounds in all 4 quadrants. Normally I listen for 10 seconds, but I'd say your vowel sounds are kind of hyper, because as soon as I put my stethoscope on them, I can hear them roaring. I'm going to percusp now, so I'm going to put one hand on your belly, and I'm going to tap one of those fingers with my other hand. Just trying to relax. Tympani throughout. Very nice. I'm going to go ahead and touch your belly. You're going to feel my hand. Okay. Now a little bit deeper. I'm going to use 2 hands. I don't feel any masses, and I don't feel any organ enlargement at all. So very nice. Now, I'm going to check your range of motion of your lower extremities. You can put your leg down, both of your legs down for a second. Go ahead and raise one of your legs all the way up. Bend your knee. Now rotate that knee towards the outside. Now go back in across your body. Good. Down. The other leg, same exact motions all the way up, as far as you can go. Bend your knee. Rotate the knee towards the left. Bring the knee back in and down. Okay. Full range of motion of your lower extremities. The next move, put your heels together. Kind of swing your legs, both of your legs out. Now together. Okay. Very nice. Full range of motion of the lower extremities. You did very well. That completes the exam. Thank you, Mr. Vargas.